Hi guys, it's Hannah. I hope you guys are doing well. I miss you all. Today I am here to share my research with you about rheumatoid arthritis. So what is rheumatoid arthritis? It is an autoimmune disorder or disease that causes inflammation in the joints and the tissues around the joints. It's a very systemic, debilitating, and chronic disease. Typically, these patients who have rheumatoid arthritis are not aware of when their pain is going to come and go. They have very significant flare-ups, and just this kind of unknown of when their pain is going to arise causes significant stress in their lives because of that reason. And so because of that, it definitely affects them both physically and mentally. Overall, the quality of life is significantly reduced in patients who have rheumatoid arthritis. The first line of defense against this is an anti-rheumatic drug, but that only is taking care of the physiological side of the disease and not the psychological side. And we know, based on the biopsychosocial spiritual method, that it is critical for the entire overall wellness of a person to treat the whole person and not just like the biomedical physical side of things. So those with rheumatoid arthritis have increased stress, anxiety sensitivity, depression, and they have excessive worrying. They also have increased morbidity and reduced life expectancy, and that's due to just a significant pain that they have, the debilitating nature of the disease, and just the significant impacts on their mental health that this disease has as well. So then again, they have just an overall decrease in their mental health. So some treatment options. I found acceptance and mindfulness to be extremely valuable in treatment. These kind of fall under the CBT umbrella, which we know a lot about. But the acceptance part really fascinated me. They found that acceptance of pain predicts improved function regardless of the severity of pain. And I found that fascinating because if one person has pain up here, another person has here, their function, if they accept their pain, is going to be significantly improved. And they also found that accepting that pain will bring less depression, and they'll have less physical disability than those who maybe are not accepting of their pain. And then mindfulness, we've talked quite a bit about mindfulness as well in this class, but just a reminder, mindfulness is basically being aware of your thoughts and feelings in the present moment without being judgmental of those things. And so basically mindfulness can be looked at as a key mediator between pain experiences and the outcomes of that pain. And then another aspect of mindfulness is just breathing and breathing exercises. And so they found that when you're mindful and you're practicing breathing exercises, that stress can be significantly decreased as well. Mindfulness will decrease pain and overall disability. And just kind of the picture of mindfulness is that mindfulness will influence the mind to think about your pain, and then the mind will therefore influence the body and affect how the body responds to the way you're thinking about that pain. Another treatment option, come on, here we go. Another treatment option that I found to be extremely beneficial in my research is yoga. Yoga is extremely holistic. It is a physical exercise. You practice mindfulness in yoga, and there are mind-body connections that are made during yoga, and they are incredibly strong, and they just positively affect the body function in many ways. And in this practice, in this research that they did on patients with rheumatoid arthritis, they found that they had increased joint flexibility, genomic stability, they had regressed inflammatory processes. They improved neuroplasticity, and they were able to harmonize circadian rhythms, all of which are extremely beneficial to the overall health, well-being, physically and mentally in these patients. They also found that they had a significant decrease in just their overall severity and symptoms of their rheumatoid arthritis when they were practicing this yoga. They were able to perform activities of daily living without much difficulty, which is huge, especially just with the debilitating nature of this disease. People want to be able to have independence and to be able to use yoga to perform these ADLs is just extremely significant in just treating the client and the patient in the best way possible for them to maintain that independence. And then because of yoga's ability to suppress disease activity and the severity of the psychosomatic symptoms, it is considered to be a promotive, curative, and rehabilitative means of treatment for individuals with rheumatoid arthritis, which is just really what we desire with the biopsychosocial spiritual model of medicine. And then a verse that I found that I just thought would be encouraging for individuals with rheumatoid arthritis is Psalm 16:9, which says, "Therefore my heart is glad and my tongue rejoices. My body also will rest secure." And this kind of brings me back to the mindfulness idea of when we are mindful, we're able to maybe practice gratitude or, practice forgiveness or praising the Lord for different things that He has given to us, and how it proved that our mind affects our body. In this verse here, it says that when our heart is glad and when our tongue rejoices, when we praise the Lord, that our bodies will also rest secure. And it's just extremely fascinating to see that the Bible is supporting these same things that we are finding and proving in science every day, which is just amazing to me. So here are my sources, and thank you so much for listening. I look forward to learning about everyone else's topic. Bye, guys.